So in part 1, we covered steps 1 to 3 of managing chronic pain in sickle cell, which is basically a lot of the pre-work and planning that goes into it. So we're at the stage now where we're about to very, very slowly reduce the exposure to opioids, which are triggering a type of chronic pain called hyperalgesia. Step 4 is covering another form of pain that can blend into chronic pain, and that's called neuropathic pain. This requires starting special nerve painkillers such as duloxetine, amitriptyline, pregabalin, gabapentin. For some people, these can be difficult to tolerate, so again, a trusting relationship and open communication with your hematologist is essential, as well as having a pain specialist involved. Now, step 5. After the previous steps have been successful, the final step is to develop a plan for managing acute pain presentations to the emergency department. This is going to be challenging, which is why having the mental health support in place is so important. The main issue is telling the difference between a sickle cell crisis and a flare of chronic pain. Sickle cell crisis pain needs high dose opioids. A flare of chronic pain, we actually want to limit the exposure to opioids. Now then, doctors will likely measure your percentage of hemoglobin S in your blood, and if it's below 30%, will maybe conclude that you're not having a sickle cell crisis and it's just chronic pain. I know it's controversial and we'll cover it separately. If there are no sickle cell complications present, like acute chest syndrome or hemolysis, then starting a high enough dose of oral opioids to relieve the pain is likely the best option in the grand scheme of things. This is because IV opioids hit the nervous system harder and are more likely to undo the weaning progress that you've made. If you're having a complicated sickle cell crisis and it's clearly not chronic pain, then staff should have the flexibility to just give the IV opioids, because trying to restrict to orals, especially if the dose isn't high enough, is just going to cause more stress and more sickling and pain. So we'll leave it there, otherwise it will be too long, and I want to hear your thoughts about managing chronic pain, particularly in the emergency department, and then I'll continue to elaborate on more details, which I'm sure will come up in the comments.